Hey everyone, this is Justin with Atlas. Today we're going to talk about soft tissue healing, and more specifically, we're going to talk about the acronym Peace and Love and the RICE method for soft tissue healing. Before we get into talking about our acronyms for soft tissue healing, let's go over what is a soft tissue injury. And a soft tissue injury is damage to muscles, ligaments, tendons, or any other soft tissue in the body. Generally result in pain, swelling, bruising, and damage to the tissue. They're generally classified as contusions or bruises, sprains, strains, tendinitis, bursitis, or a stress injury. And there's two common categories, acute and chronic. Acute would be like an ankle sprain. Within the first 24 to 48 hours, there was a sudden incident or injury that led to damage of the soft tissue. And then a chronic injury is something long-standing, something from repetitive stress or overuse over time. Over the years, orthopedists have come up with many different acronyms to describe the best ways to heal soft tissue injuries. The most common being the RICE method. The RICE method stands for rest, ice, compression, and elevation. It's been around for a long time and it's used by many. But even the doctor who created the RICE method has come out and stated that this method is outdated and there are better ways to heal soft tissue injuries. So we have a new acronym. The way we're using is called Peace and Love. It encompasses the continuum of rehabilitation from the immediate care of the injury to the subsequent management of the injury, going through the whole process of healing. It includes the importance of educating patients and addressing the psychosocial factors to enhancing recovery. It also highlights the potential harmful effects of anti-inflammatory medications. In the beginning phases of soft tissue injury healing, generally the first 1 to 3 days, we're going to focus on the PEACE acronym. The PEACE acronym stands for protecting the injured area by unloading or restricting the movement. This is going to reduce bleeding and reduce the risk of aggravating the injury, but we're also going to minimize rest and let our pain guide removal of the protection and gradual reloading of that injury. Prolonged rest compromises tissue strength and quality. Then we're going to elevate the injured area higher than the heart. This is going to promote fluid flow out of the injured tissue and help remove some of that additional swelling that doesn't necessarily need to be there. Then we're going to avoid anti-inflammatory modalities, and this includes over-the-counter medications and ice. Optimal soft tissue regeneration is supported by the various phases of the inflammatory process. We want to allow that inflammatory process to happen. Ice and over-the-counter medications are generally widely accepted as an intervention for soft tissue healing, but there is very little quality evidence that supports the use of either of these in the treatment of injuries. We're also going to compress the injured area using a bandage or ACE wrap. And then we're going to educate ourselves on the healing process and making sure we're avoiding any unnecessary treatments that may delay the healing process. After a few days of letting the inflammatory process kick in and the healing process to begin, you're going to begin the second half of this healing process called the love process. We're going to start by loading the injured area, and that's adding weight to that area without increasing your pain. Loading injured tissues promotes their repair and their remodeling, and it builds the tissue tolerance and capacity back up. Normal activity should continue as soon as your symptoms allow for it, and you can do them without increasing your pain. You also want to keep a positive outlook or have optimism. The brain plays a significant role in rehabilitation. Frustration, anger, and depression can limit the body's healing capacity. You want to stay realistic, but encourage optimism to improve the chances of an optimal recovery. Then you want to vascularize the area, and that's increasing your cardiovascular exercise to improve the blood flow to the injured area. This should be pain-free as well, and it's also a mood booster and a motivation booster. Finally, We want to use exercise, therapeutic exercise, to restore your strength, mobility, and balance or proprioception back to normal.